Here's a 44-year-old male referred for neurological opinion with a 6-month history of progressive right leg weakness, wasting, and intermittent painful spasms of the right quadricep. In the preceding month, the patient had also noticed progressive weakness of his right arm and difficulty when writing. He couldn't button his shirt anymore. He had no sensory symptoms. The only past medical history of note was migraines with aura. This is, 44-year-old guy. EMG evidence of a lot of muscle dysfunction and fasciculations. So what do you have? Progressive motor syndrome, clinical evidence of upper and lower motor neuron degeneration, EMG evidence of widespread acute denervation, hyperintensity in the cortical spinal tracts, and MRI, a diagnosis of amyotrophic lateral sclerosis, ALS. Routine blood tests showed anemia, low iron, ferritin, and folate. Really sharp neurologist said, wait a minute, you're not supposed to have anemia when you've got ALS. How come you've got these deficiencies? What's going on here? Sure enough, he was a celiac. So, started on a gluten-free diet 7 months after the onset of his symptoms. No drugs, including riluzole or other agents with neuroprotective potential, were given. Nothing, just a gluten-free diet. 9 months after starting the gluten-free diet, the patient's right arm back to normal. Improvement in the patient's right leg function was noted, but he had so much wasting it hadn't gotten back to normal yet. Now able to walk unaided, he's out of the wheelchair, however, and his handwriting and ability to fasten buttons had returned to normal within 9 months on a gluten-free diet. And look at the MRI. Their presentation, 2 months later, 9 months on the gluten-free diet. Gone on the left, almost gone on the right. Gone on the left, almost gone on the right. Much smaller on the right. Have you ever reversed white matter lesions in the brain on a gluten-free diet? You will now.